Good afternoon, everyone. This is Emily Clark, Information Specialist for NCCMT. I'm the coordinator for the Spotlight webinar series brought to you by the National Collaborating Center for Methods and Tools. Thank you to those who have joined us this afternoon for the Spotlight webinar series. Today we will be featuring the Clear Communication Index. We'll quickly review a few housekeeping items before we get started. Please see the chat section on the bottom right-hand side of your screen in WebEx. You can post any questions or comments you may have during the webinar. We will have a designated open Q&A session at the end of the presentation, but feel free to post any questions or comments you have during the webinar, and we'll answer those as we move along. Please post so that it posts to all participants, as other participants may have the same questions that you have. We do recommend using a wired internet connection as opposed to a wireless, and if you do run into problems with WebEx, the WebEx 24/7 helpline number is posted on this slide as well as in the chat window. After today, the slides in both English and in French, as well as the English audio recording, will be made available on the NCCMT's SlideShare and YouTube account. The links to these are posted in the chat section. We do aim to have these posted within a week or so of today's presentation. We'll now start today's first polling question. We would just like to get a sense of the audience that's joining us. We're wondering how many people are watching today's session with you, whether it's just by yourself, if you've got a group of 1 to 3, 4 to 6, 4 to 5, 6 to 10, or if you are in a larger group watching together. You can answer this question in the poll question panel on the side of WebEx, and just remember to hit submit so that your answer actually gets submitted. So looking at the results, which I realize are not posted, but the results say most people are joining alone. We have a couple, actually quite a few smaller groups, and even one group of over 10, so we're very pleased to have you here, and we do hope you enjoy the presentation. I would now like to officially welcome everyone to the NCCMT Spotlight on Methods and Tools webinar series. This is our 31st episode of the Spotlight series, and we will be featuring the Clear Communication Index. We will post links to the registry page for this tool in the chat window, as well as we'll have links for the website in the chat section as we move along through the presentation. For those of you who may be unfamiliar with the National Collaborating Center, we are actually one of 6 NCCs across Canada. We're all funded by the Public Health Agency of Canada. We here at NCCMT are located at McMaster University in Hamilton, while the other NCCMTs across the country focus on the use of research evidence in specific public health content areas. We here in Hamilton are focusing on improving the access to, as well as the use of, methods and tools for health professionals in practice within Canada. So as opposed to being content-specific, we have methods and tools that can be applied across all different areas of public health. Just to highlight a couple of the products and services that we have available through our website. Many of you may be familiar with some of these. Today, the tool that we're highlighting is located in the Registry of Methods and Tools. We do also offer quite a few online learning opportunities, as well as workshops on request across the country. So now this leads us to our second polling question. We're wondering how familiar you are with the Clear Communication Index that will be discussed today. Either you're not familiar, you've heard of it, or you've actually used the method and tool. So again, after you answer the question, just make sure that you hit submit at the bottom right-hand side. So it looks like most people are not familiar with it yet, which of course we will fix with today's session. And a number of people have heard of the method and tool. Oh, and a couple of people have actually used it as well, so that'll be great. If you have any comments or questions, make sure that you post those as well. So I would like to formally introduce our presenters today. It's my pleasure to introduce Lourdes Martinez, a health communication specialist for the Centers of Disease Control and Prevention, as well as Sarah Gilman, who's the director of the National Resource Center for Lupus, And she will be providing kind of a user story, a description of her experience actually using the tool following Dr. Martinez's presentation. So with that, I will hand it over to Lourdes, and Lourdes, I will make you the host of the presentation now.
Thank you, Emily. I really appreciate it. Welcome to all of you. Thank you so much for dedicating time from your busy schedules to listen in today. And hopefully we'll have some really good discussion after the presentations that we've prepared for you today. As Emily mentioned, I'm a health communications specialist here at the CDC. My background covers a variety of areas, not just in public health, but also in healthcare. So as a health education specialist working for our Veterans Health System, and then moving into surveillance and informatics networks. And then before I ended up in the current position that I'm in, I also worked across a variety of chronic diseases, supporting strategic communications for those conditions. So the position that I'm in now is the part of the agency, the Office of Communication Science, that developed the Clear Communication Index. I've been here now for almost a year, and we do also training on the index. So questions that lie along those lines will be welcomed as well. So I've organized the first half of the presentation to give you background on the index, and then we're going to work through each of the sections, and I'll finish by showing a few examples of how we have applied the index here at CDC. So the great question that sometimes we get asked, either directly or indirectly, is why is it so important to focus on clarity? Well, there's three reasons that we find are most important to discuss when we are promoting the importance of clarity, particularly through the use of the index. And the first one is that we want to be effective. Our goal with any communication is that it informs and educates so that the end user can then act on that information. The second point in support of clarity is the science. At CDC, we believe that science informs our practice beyond just what our laboratorians are working on, but also in our policy and communication development. And third, it's the law. In the U.S., we have the Plain Writing Act of 2010 that President Obama signed into law, and that has been the guideline of the development of our health literacy program here at the agency, as well as all of the activities that we've done in support of that. So developing websites for clear communication, for health literacy, training our staff to understand the concepts behind clear communication and plain writing, and the importance of it, because we're not just talking about a person who needs to take a new health behavior so that they can extend their life. We're also talking about professional audiences and their need for just-in-time information that they can then act upon to provide to their constituents, whether it's a mom providing healthy development for her newborn, to people responding to natural disasters or workplace hazards. So the index itself was developed and led by two of our scientists here at the agency, Dr. Cynthia Bauer, who recently left CDC to take on a prestigious position at the University of Maryland, and Dr. Christine Prue, who's a behavioral scientist here in the Emerging Infectious Diseases Center, and has been doing a tremendous amount of work recently on the Zika virus. They were then supported through the contractor RTI International and Communicate Health Incorporated. And there was a multi-step process that occurred, and we'll go through each one of those in the next few slides. It's important to let you know that at each one of the points, we wanted to make sure that we had all of the stakeholders involved. And by that I mean not just those who represent the experts or the content experts, but also the people at the very end of the spectrum that would be receiving the materials that we developed or edited based on the index. This is a listing of the expert areas that the panel represented. As you'll see, it reflects science, health, folks with a background in numeracy, health behavior science, and risk communication, and a variety of other areas as well. This diagram shows the framework on how the index items were developed. So you'll notice that the very first step was to review the literature, not only in those areas that our expert panel represented, but in any area that touched the communication science and what we already knew. And those findings were then distilled and presented to the panel to then start actually developing the items that went into the index and those first drafts. Once the review process and moving some items out, bringing some items in was completed, we ended up with 23 original items from this framework. Testing took on a few phases, as you'll see here. We recommend that when you're developing an item that you have 2 reviewers score the document, and the best way to do that is to have those 2 reviewers not be of the original writers of the item, because it helps to make it more objective in terms of the review. And as we get into the exact questions of the index, we'll talk a little bit about the importance of having some objective reviewers to that material look at the product. So the very first group, the study team, and that included Drs. Bauer and Prue, started to test those 23 items that I mentioned were originally developed with 7 materials. And they had 2 people each so that they could then come back and examine inter-rater reliability on those items. Then the panel was able to review the index with those 23 items and the results of the initial study team. And we started then to recruit communicators from various areas across CDC. So we had people from the policy world, we had high-level administrators in communication science, so these were the directors of communication science, as well as those staff who are on the ground in programs that we call communication specialists. And the process that they undertook was to receive the score sheet, again, with those initial 23 items. And as they scored a material, we asked them to use the think out loud technique. So basically, as they reviewed, we wanted to hear how they were understanding the index, how they were approaching the use of the tool. The next step was to conduct some focus groups, and we recruited dyads to reflect subject matter experts, so typically your science background, your health scientists, and communication staff. At CDC, we develop our materials many times in teams represented by these 2 groups. And we thought that this would be a very real-world way of testing the tool. We recruited from 4 different centers reflecting environmental health, infectious diseases, immunization, and chronic diseases. And we had those dyads work on scoring a material. even today when we are training on the index, now some years after it's been used, we hear some of the greatest stories coming out of communication between subject matter experts and communication staff, because it's an opportunity for both of these folks to come to the table and agree upon the audience. And we think sometimes automatically we all know who we're talking to, but these conversations bring to the forefront misunderstandings perhaps on who the audience is and what our objective is with the communication material. So these conversations were used to develop the index, but are still so important even now after we have the tool in place. So getting into the final index, the one that we know today, there were a few less items after this user testing took place, and that generated a total of 20 items on the index. We also edited the user guide, and this is something that you can access on our public website as well when you access the index. And the user guide is particularly helpful because it gives specific examples for each one of the items and guides you in answering the questions as well. We also went from a manual score to one that is automated through the PDF document, and created a widget as well that is accessible on the website. And this just makes it even faster for the user to score and provide feedback to the developer of the item. And then finally, our initial trainings took quite a bit of time. It's very difficult to find time in the day to find training or to receive training, but when you're talking about half of a day, that was quite a bit. So we've now focused our trainings down to about an hour and a half, and tailored them specifically to the need of the program or the condition, the disease condition that we're helping folks through. So it's more of an applied rather than comprehensive presentation that we provide now. And the last and probably one of the most important pieces of testing once the final index was in place, so now the one that we know, the 20-item index, it was tested in a sample of almost over 800 people. At the bottom of this slide, you'll notice the reference to the study showing the validity of the index, and I've included a link that you can access the PubMed abstract of that. But what the validity study showed is that on every item that was presented, when you compared the materials that did not use the index compared to those that were revised using the index, there were significant findings for use of the index, so those materials that had been edited. Specifically, with regards to the main message on one of the materials on thimerosal, which is a product basically found in a vaccine, we noticed that there were 65% versus 45% of people who understood the main message when you compared use of the index compared to not using the index. And when we're talking about understanding familiar words, understanding numbers, we had, again, significant findings. So people said that items that use the index, they understand the numbers 30% compared to 15% for the items that did not use the index. And overall, the study goes on to discuss all of the users that responded on the materials developed with the index found it easier to understand, quicker to find information that they were interested in, and they would be willing to share with others. So the whole point sort of wraps back around to that issue of clarity that I discussed at the beginning of the presentation. When we want to be effective with our information, when we want to share the best science, it's important to use an evidence-based process. products such as the index. And now we're going to go into the specific example of the tool. So we use the index for a few reasons. One, and the one that we promote the most, is to design and develop new communication products. So we ask people to have the index side by side their source documents as they're developing, so that it's almost, the index becomes a guide rather than a score sheet on developing material. But it's also useful if you want to look at your communication products, your existing products, and score them based on the index, and then revise them on the findings that the index points could be opportunities for improvement. And as I mentioned earlier, it's still important to us that we have those conversations and clarify who it is that we're talking to and for what purpose we're talking to them. We divide the index into a total of 20 items, but there are 4 sections, and then we have the cover page that we refer to as those 4 questions. And throughout the whole totality of the index, we cover main message and call to action, the language that the audience uses, and this is not so much specific to English, Spanish, French, but more about the words that they use that they understand. The information design, so how something is laid out, how it looks, what we know about the science, recommendations that we're making on a specific behavior, if that applies, the numbers or statistics that we use to describe incidence and prevalence, and also the risk message behind the information that we're presenting. So before we get into the actual index, the cover page presents 4 key questions for the developer, the product developer. And it's really important that I should say this is where you want to spend your time, because no matter where you are in the development process or how successful you are, there's going to be times that you might be challenged on the answer to one of the items. But coming back to who is your audience, what is the communication objective for this material, and what is your main message will help you to have clarity in answering the individual index items later. So it's important to really spend time here and think about what you want for this product. And just a quick note on the health literacy skills. Sometimes when we're developing materials, we may not know the audience enough to know their health literacy skills. So in the event that you are not familiar with the audience to know this, our recommendation is that you assume low to average health literacy skills. Now, Part A is the section. It has 11 items, and we'll go through those now, but just to take a moment and remind folks that the cover page and Part A are the parts of the index that apply to any kind of product that you're developing and to any audience, whereas Parts B, C, and D would only be used as needed, and when we go into those sections, I'll give you some examples of where they may be applicable and where not. So now that we're in Part A, you'll notice the very first question is, does the material contain one main message? And what you'll notice in the automated form of this score sheet is that if you were to click no, then automatically the score sheet will click on no for the questions 2 through 4 and question 5. And that is because it assumes that if there's no main message at the top, then you're not being upfront and clear about what the purpose of this material is, and there is no support for that main message. So that's why it's so important, again, as I mentioned in the previous slide, to spend time developing what that main message is for your product. The second half of Part A covers language, as I mentioned. So what are those words that are common? And this might be a geographical question. So some, at least in the United States, we have words that are more common. For example, with glucose, some folks, some areas call it sugar instead of glucose. So it's important to know those variations. And also, if you're addressing a professional audience, perhaps one group, if it's an epidemiological group, they may use incidence, prevalence, disease ratios, where others who don't have that background won't use that. So this is what we're referring to with item number 7 specifically. And item number 6, when we're talking about using that active voice, is being very clear, using words that convey action and meaning, and not just losing the intent of the message. Information design, this talks a lot more about the bullets, the spacing of information, which I think most of us in communications probably already know this piece, but it's important to bring in. And something that's very common in a lot of materials is that we use as a header a question. For example, how much physical activity do I need? Now that is an effective heading because that may be a question that the audience has. But we also make a recommendation that if people are only scanning your headings and they're not going to read the rest of your material, then take advantage of that heading and give them specific information. So instead of how much physical activity do I need, a heading might be get 150 minutes of physical activity weekly, and then your following bullet points might specify how to go about doing that. The last part of Section A, and this has been a challenge and one that we're working through, is the state of the science. We're very good at telling the public what we know, what science can tell us about a particular condition. But what the area we've done really well in, particularly after the Zika virus, is talking to people about what we don't know, what's still in development. And it's perfectly okay to let your audience know that science takes time, and as we're developing and learning from an emerging disease, for example, these are the steps that we're following. So it's not always just saying we don't know, but telling them what we're doing in order to learn more. And there are examples of these different items on the Clear Communication Index website that you can reference for more concrete examples. So now Part B, which gets at the behavioral recommendations. This is a little bit different than the call to action that's part of Part A, of the item in Part A. Here, for example, let's say you're talking to someone or developing a material that talks about the steps to stop smoking. Well, that would be a behavioral recommendation, because you might tell people, call a quit line, or take a deep breath when you start to feel the urge. So those are the specific behavioral recommendations, compared to a call to action that might be a policy on safer routes to schools. Learn more about this policy by visiting this website. So when you think about the call to action, it's really just a step that someone will take to get more information or to do something. Whereas with a behavioral recommendation, we're suggesting these are the things you want to do to improve your health or make a change. Number 13 is a little bit tricky, I think, sometimes for folks when they're trying to develop content to answer this one. And an example might be, in public health, we know, for example, the statistics on colon cancer in men. We know that it's important that they get a colon cancer screening early. And while that's great for us because we know that that's what people should do, for the individual, there may be some barriers involved in that are not some that we've thought about. So it's important that we go beyond that recommendation of this is what the statistics show, and also talk about screening early might increase the chances of preventing death or disability, which would require that you may use a colostomy bag, for example. So really getting into why it's important for that audience to follow the behavioral recommendation and being very clear about why that's important. Part C talks about the numbers that we use, the statistical references that we make in a product. So if our audience are a group of epidemiologists, then it's perfectly fine to include confidence intervals, for example. But if our audience is a group of mine workers, for example, then they're probably not going to focus so much on a confidence interval. They're going to want to know how many or how common is it that I might be at risk for a particular health condition. So this is when we make a recommendation of using ratios, for example. So 1 in 4 people get X condition, and also giving people a frame of what that means. That's where number 16 comes into play. You'll notice that for number 17, the scoring flips. In this case, we're asking if people have to conduct a mathematical calculation, then it would score a 0, because we want to make the material easy for people to quickly get what they need in order to make a decision, in order to make an informed health decision. So this is one where the numbering, the scoring is flipped. Part D talks about risk. And again, if you're not talking about risk in your material, this would not be an area that you would score. But I want to call particular attention to 2 things in Part D. The first is for item number 19. I think it's very easy for us in public health to talk about the risks and benefits of a recommended behavior, but usually we're talking about the actual risks and benefits, what we know again from science. But we have to take into consideration what the perceived risks and benefits are for the audience. So if I go back to an example on smoking, if we're making a recommendation that people quit smoking because it's risky for their health and we have numbers and experiences to share with them of those benefits, we should also think about what the perceived risk might be for a person, being they can no longer go outside and socialize with their friends. So calling that out is important in being able to reach your audience beyond just what they would expect us to convey to them with actual risk. But think about what your audience's perceived risks and benefits could be as well. In Part D, we also identify numbers 19 and 20. We give an option of not applicable, because it's possible that you may only be discussing the nature of the risk as noted in number 19. But there wouldn't be, perhaps you don't have a behavioral recommendation as was discussed earlier in Part B. That's where 19 and 20 would figure in. So if you're completing Part B, you're quite likely going to be including content that would be scored with numbers 19 and 20 here. And then finally, we have the calculation of the score. And again, this is part of the PDF and the widget. So this is just to show you how the scoring is conducted, but it is automatic with the PDF and with the widget. Now, we had always made a recommendation of 90 or above passes for a clear document, but we noticed that people were so focused on that 90 that they were less interested in the actual items and in building a good product. So our approach has now moved to start using the index to build your material, and that will automatically get you to a 90 or above. So briefly, so that we can get into our example from the Lupus Foundation of America, our good partners there, I'll run through some examples that we had here with CDC materials. This is the original frequently asked questions document for thimerosal. You'll notice it was just a very thick listing of the product, but there really wasn't a main message. We start talking about the different types of mercury, and it's just, again, heavy text. So with a rewrite of the FAQ, what we'll see here is now we have a visual, a main message, which is item number 4 in Part A. We have the message located at the very top, which is, you remembered, in Part A as well. We use active voice, so you can ask for a flu shot. Very clear here. And then the language of the primary audience. We're not saying vaccines or vaccinations, we're saying shots. Here's an example of a rewrite of the question, what is thimerosal? And the revision is a lot shorter, it's a lot cleaner. Again, it uses the active voice rather than passive voice. In this example of heart disease, we see questions about, well, is this are these the numbers that a lay health person who needs to know about monitoring their heart disease? Are these the numbers that they would be familiar with? So in the revised, also in that information, there was a lot of heavy maps with disease ratios and information that would not be appropriate for a general audience. Though the map data and the data in that first screenshot that I showed you with all the numbers was redone, and this is the final product. So here we see a very clear presentation of what the numbers represent for the audience. So 1 out of every 4 people die because of heart disease. It's reflected not only in text but also in the visual, and that is supporting the probability item that we have in Part C of the index. This last one shows another very clever example of what the risk means for people. So basically, if you have any one of these risk factors, so inactivity, obesity, et cetera, the more you have, the more at risk you are of heart disease. And again, accompanying a visual with a text presentation really helps those who have low numeracy skills as well. I thank you so much for your time, and this is my email if you have any direct questions about the index. And I've also added the URLs for our 2 websites, and if you have questions just for generally of our program, you can email us at healthliteracy@cdc.gov. Thank you.
Wonderful, Lourdes. Thank you so much. We really do appreciate your the excellent summary of the tool and examples of its use. Now we do have a more in-depth example coming from Sarah Gilman. Actually, Lourdes, if you can just advance the slide. Perfect, and I will now hand it over to Sarah. Sarah is the director of the National Resource Center on Lupus, and Sarah, you now have the ball, so it is your presentation.
All right, thank you. Lourdes, it was so nice to hear that description of the Clear Communications Index again. I'm just always reminded of how much there is for us to learn. Hello, everybody. How are you? My name is Sarah Gilman. I'm here on behalf of the Lupus Foundation of America, and I'm really excited to share with you our experience with the Clear Communications Index. So I'd like to talk today a little bit about our foundation, just so you have some context for why the index has been so important to us. And then I'll talk a little bit about the index itself, including how we learn to use the index, what our internal guidelines are for how we use it, and any recommendations that we've put together over time for using this tool. The foundation is dedicated to improving the quality of life for all people who are affected by lupus through research, education, and advocacy. And we serve all people who are affected by lupus, whether that's people who've been diagnosed with lupus, people who think they might have lupus and are going through the diagnostic process, caregivers, loved ones, and also their healthcare providers. One of the key interventions that we use in order to reach people is our health education content. And the main mode that we use is our website, which currently receives over 8 million visits per year. Our social media posts are also very popular, receiving hundreds of interactions from our followers, and our health educators use our content daily in every interaction that they have with our constituents to send them links to pieces of content. Predominantly, people want to receive things online, and so we spend a lot of time working on our online content as well as our print content. And really, what's driven a lot of this is the development of content online is really a grant that we received from the CDC last year to build what we've called the National Resource Center on Lupus. And what this is a digital hub for the lupus community, essentially a website, but hopefully a little bit more dynamic than a website, and a source of support, empowerment, and information for anybody that has questions about lupus. The idea is that it be really dynamic, broadly focused content, and that it keeps people coming back for more. So not necessarily a static website, but a website that's continually updated with multimedia information across a wide variety of topics and formats that really draws people in. We use the phrase here, help them to eat their veggies, a lot when we talk about health education content. And what we mean by that is that it's our job to design health education content well enough and to make it clear enough that people then want to go out and act on that information. If we're putting out all of this health education information and people aren't motivated to act on it, then we consider that to be a problem on our side. And so that's part of the reason why the Clear Communications Index is so critical for us. This is a screenshot of the National Resource Center on Lupus. It's not live yet, so you guys actually get a little bit of a sneak peek here. The site will be going live towards the end of March. And as you can see, we use a lot of the best practices of the Clear Communication Index, even in the design of the website. Having information that's actionable, having a clear call to action here, using the active voice, using the language that the primary audience might use. And this was actually not something that we discussed actively with CDC, but through our training on the Clear Communications Index, it sort of permeated all the work that we do. And so I just wanted to show you a little bit of the Resource Center to give you a sense of why this focus on language has been so important to us. This is one of our more specific collections designed for people who might have lupus. As you can see, there's quite a bit of information here. And this is sort of narrowing down one of the pieces that we worked on with the CDC. So as you can see, it's a lot of text. It's not really visually broken out in any particular way. We're missing a main message. There's a lot of inconsistencies with this particular piece. And so what we did was we did a 2-hour training with the CDC, where we first asked the 4 primary questions, and then we went through the modified Clear Communications Index score sheet. And this was tremendously helpful to us. I'll show you an image of what this looked like after. This is what we currently have for lab tests for lupus. It's just a little snippet, and it's a little bit hard to read. But the idea behind it is that we really took a lot away that impacted the way that we write and design health education content for our constituents. Just scanning the page, you can see that the way that we've broken out content invites the reader to scan and have a sense immediately of what's on that page. We spent a lot of time working on the level of health literacy for this document, and we also spent a lot of time thinking about the main message and making sure that the main message and the basic facts were presented right up front, so that somebody who is interested in learning about the lab test for lupus doesn't have to go through 2 to 3 pages of content to learn the main gist of what they would need to know about in terms of lab tests for lupus. We have quite a large content team, or what I like to consider a large content team here at the Foundation. And again, that's because we've really find our health education content to be such a valuable tool in terms of being able to create positive health outcomes. And so our content team really spans multiple departments, but it consists of, in this case, it's the Education and Research and Marketing and Communications department. It consists of 2 writers, a graphic designer, a digital marketing manager who really helps us figure out how we're going to package and position the content that we create, a communications director, and a content director, and also a marketing director. So this content team is, obviously this is not all that we do. We have other things that we do for the Foundation as well, as is the case in almost every nonprofit. But whether we are from the Education and Research Department or the Marketing and Communications Department, we work as a team when it comes to health education content. And that's really important because when we implemented the use of the Clear Communications Index, having that set up where multiple members from different departments could be part of the same team was really integral to getting the Clear Communications Index to be accepted. And having the Clear Communications Index has also made it a lot easier for us to really drive forward our content pillars. So our content pillars are an integral part of our content strategy. And essentially, a content pillar answers the question, what do you want your content to do for your readers? It's going to be different for every organization, but for our organization, the 3 things that we want our content to achieve are to make people feel empowered, to educate people, and to help them feel connected to each other. So being able to create language that is clear and accessible and has clear calls to action and gets our message across quickly and powerfully is really important to us and has really been helpful to us as we move forward with this National Resource Center on Lupus. I will say that our experience with the Clear Communications Index has really been part of this larger journey for us as a foundation that started really in 2014. In 2014, we started an organization-wide health literacy campaign. We attended a health literacy conference. We had several staff members educate themselves about health literacy. And we designed and organized a seminar for the entire organization, including the CEO and the vice president of every department. And that was really integral in terms of getting buy-in at the highest levels of the organization so that we could then move forward with specific activities. In October of 2016 was when we conducted the CCI training for our content team. And that was the 2-hour training where we used the actual use examples that I've showed you regarding lab tests on lupus. And presently, we've moved into regular use of the Clear Communications Index with every piece of content that we produce. And I'll speak to that more in a bit regarding the specific guidelines that we give our writers. Our writing guidelines internally are fairly specific. We ask that anybody who's involved in writing any piece of education content keep the Clear Communications Index handy. That can be a desktop shortcut, it could be the widget, it could be a printout that's physically at their desk. For me, the Clear Communications Index is taped to my whiteboard right next to my desk. So when I'm reading something, I can just glance at it very easily. The expectation, both for our writers and our editors, is that every piece that's in production will be measured against the tool, and that when they create a piece, that they not begin that piece until they know what the answers to the first 4 questions of the piece are. So often I'll get a pitch from a writer with a description of the story that they want to write, but also written out the 4 answers to the first questions on the Clear Communication Index score sheet. And that tells me that we're going to have a pretty good product. If they know going into it who their primary audience is, what language they need to write in, what the primary communication objective they want to get across is, and what the main message is, I can have a pretty strong sense that we can move forward with this piece. So even in terms of project management, it's been a really essential tool. But in my experience, we work at a pretty fast pace. So although we'd like to go through the entire index, it's not always possible for us to go through the entire index as well as parts B and C. But what we do require at a minimum is that the 4 preliminary questions be completed and that we go through the score sheet for section A. As Lourdes said, we encourage our writers to really have this in front of them so that as they're writing a piece, they're cued to develop the piece with Part A in mind. But either way, they know that at the end of writing that piece, what they've written is going to be evaluated by their editor with section A in mind, and that's been really helpful. If we have a section that's a little bit more specific or it's high priority, we certainly do go through the rest of the index. But I would say as part of regular practice, we tend to do, at minimum, the 4 preliminary questions in section A. And having had this experience, there's just a couple recommendations that I would share with you if you're interested in undergoing the Clear Communications Index training. I think overall it's been a fantastic experience for our organization at all levels of the organization. I think for people who are involved on the ground floor, writing and editing, it's been essential and it's improved our writing at every level. It's certainly benefited our constituents by giving them much more actionable information and letting them access that information quickly. And we know that that's very important because based on our website analytics, we know that the average amount of time that someone spends on our website, and this isn't unusual for any website, is about 2 minutes. So we know that we don't have a long time in their day, whether they're waiting for the bus and they're Googling something, or whether they're between meetings. And we really need to make sure that we convey that information as quickly and efficiently as possible. So the Clear Communications Index has really helped us with that. But I think at a senior level, it's also been really helpful for us to be able to talk about literacy or health literacy more specifically with our more senior folks and to really bring home the idea that health literacy is directly tied to positive health, or can be directly tied to positive health outcomes, and that it's important for any health organization to be able to have a focus on that. So a couple concrete recommendations as far as using the CCI. For us, starting the journey early on was really important. We had been focusing on health literacy since 2014. We didn't know as much as we know now, having gone through the CCI training, but what it did do for us was that when the opportunity to train with CDC came along, we jumped at the chance, because everybody at all levels of the organization had a very clear understanding that this would be worth our time and that it was only going to lead to better outcomes for our constituents. So it was really helpful for us to have gone through that education process early on. There was virtually no convincing that needed to be done in order to take the CCI training. If you can take the CCI training independently, or you can have some staff take it independently, even if that means self-teaching using the website, which is very thorough, I would certainly recommend doing that. And the reason why is because you come prepared with a lot of questions. As you can see, there's a lot to consider with the index. So the more time that you spend really thinking it through prior to the training, the better off the training will go and the more that you'll get out of it. And we've talked about the idea of getting organizational buy-in already a bit, but I'll just re-emphasize the importance of getting buy-in at the upper levels of your organization is critical. At our organization, we had ample support and a strong belief in what health literacy could do for our constituents, and so it was very easy for us to enact these kinds of trainings. It's also important for any project, really, but certainly for this as well, to designate an owner or an editor or an advocate, somebody who's the primary owner of the CCI. So at our organization, that's me. When I edit any piece of content, I'm the person who's always reminding people to go back to the CCI, asking if they've completed the first 4 questions of the document, encouraging others who don't know about the CCI to take a look at the CCI and use it as a tool in their own project. So really becoming an advocate for the CCI is very important in terms of eventually achieving organization-wide usage. As I mentioned before, if you have the ability to requiring all your writers and editors to keep it handy is really helpful. On a personal level, just having it taped above my whiteboard has reminded me to use it at times when I wouldn't necessarily have thought to do so. So everybody has a different mechanism for keeping things handy, but it is very helpful. I would also suggest, at minimum, having somebody go through the first 4 questions and Part A. I think for us, 90% of the time, the main challenge that we have is answering the question, who is your primary audience? Because lupus affects so many different people. And also figuring out what is the main message of your material and where is it within all of that text. So it's really helped us think a lot more strategically about how we write. And I think those first 4 questions are really key. I also think that people have a tendency sometimes to attend trainings and then check them off the list and move on. And so it's helpful, again, another reason to designate an owner for something like the CCI. It's helpful if you can have somebody who's checking in and reminding the organization to conduct yearly refreshers or to do trainings for new staff, or even to have a yearly meeting where you sit down with your staff and go through the CCI internally. It's just good to always keep that front of mind. And then finally, the biggest piece of advice that I would give as a user is that success is in the long game. It really takes a long time to get buy-in for health literacy practices, and more importantly, to make sure that the CCI is used consistently. And so don't get frustrated if it doesn't happen right away. As long as you have a designated owner who's willing to advocate for it, it will happen in time. And with that, I will conclude my presentation. My email address is below, and please feel free to reach out if you have any questions about user experience with the CCI or some of the more practical tips that or experiences that we may have had with introducing it to our organization. Thanks.
Awesome, Sarah, thank you so much. That was a really fantastic overview of use of the tool, both in the short term and in the long term, and how to build it into your overall strategy. So I think that would be really useful to participants at this webinar and how they can use it in their own organizations. So we really do appreciate that. I can already say we've gotten a couple of private messages to the host asking, where to get the slides and where to get the presentation after. So I think this will be very, very useful moving forward. So again, we appreciate both from yourself and from Lourdes. So we have now reached the point in the presentation where we will open it up for a general Q&A. So to anybody who has a question or a comment, you can enter it into the chat section. We do ask, if possible, to post it to all participants so that anybody else participating can see what you've asked and read along, as well as see if maybe you thought of something that they were thinking about asking as well. So we're just waiting for those to come in. Again, Rawan now has posted where the recording and where the slides will be available after the webinar. Our first question that's come in is there an online CCI training tool or videos?
We currently don't have an online video of the training, but we do have a script or a protocol, if you will, and we will be uploading that within the next month.
Great, great. Next question is, how would the Clear Communication Index apply when developing a newsletter? I definitely see it being applied to each individual article, but would it be applied to the newsletter as a whole?
That's a great question, and it's one that I can affirm, yes, you can definitely use it to the newsletter as a whole. As a matter of fact, in early 2016, there was a study that came out that the index was used to assess a patient portal. So the actual frame of the portal and how it gave folks information and what to do. So you could use it, particularly the cover page and section A, to organize the newsletter itself.
Great. And now we have a question. Are you available to come out to an organization and provide the 1.5-hour training session?
Well, we could certainly talk about what the best method would be if there was interest in something like that.
Great, great. I think we have posted email addresses above. Rawan could maybe post those again so that you have the email addresses that you need to contact Lourdes for this. Another question, if you use the minimum section, so I'm guessing the first 4 questions, how would the scores be interpreted?
The 4 questions really aren't scored, so there wouldn't be a score generated from that. But as Sarah mentioned, it really is an opportunity to lay out what the expectations are for that particular message that you want to get out or the product that you want to develop. So if you wanted, there's some groups even within CDC that want to focus on, for example, their risk messaging. So they might do the cover page and focus on section D, so they would still generate a score for that section. So that's something to think about if there's areas that you want to focus on, such as numbers, behavioral recommendations, or just the core, which is part A.
Okay. Another question, would you use this tool if your target audience is health professionals?
There are various examples across CDC that have used it for health professional groups. I wonder, Sarah, have you all had that experience yet?
You know, we haven't used the tool when communicating directly to healthcare providers, but I think in general the tool is a fantastic writing tool, and so it can only help. And what we have experienced when communicating with healthcare providers is that sometimes communicators tend to be reluctant to use plain language with healthcare providers because they worry that providers are going to feel talked down to. But in our experience working with our Medical Scientific Advisory Committee, which is a group of about 30 rheumatologists and other healthcare professionals, that hasn't been the case at all. And in fact, they appreciate the use of plain language. So I would think that the Clear Communications Index could only help.
Great. We have a question about evaluation, which is how would you evaluate the effectiveness of using the Clear Communication Index? For example, if you were to make changes to the lupus website, I guess how would you evaluate the changes that you've made?
That's a great question, and we're actually doing that now. So there's a couple different ways to evaluate, but the primary way is really through web analytics. The other way to evaluate it is through what we call social listening. So through web analytics, we use Google Analytics. We look at whether site visits have increased, certainly, but more importantly, we look at time on page, and we look to see whether the average time on page has increased. And we also look at a statistic called bounce rate, and bounce rate tells a bounce, if you will, is when somebody comes to your page and then immediately leaves your site. The bounce rate is how many people did that. And so what you want to see is somebody coming to your page, seeing something helpful, and then going to another page on your site. So we look at those statistics in terms of web analytics, and we also look on social media to see whether people have shared that resource more than other times that we've used the same resource, and whether people are if there's healthy conversation going on social media, we know that we've really stimulated some discussion, and that's a good sign too. So it's both qualitative and quantitative.
Great.
And I'd like to also offer, in addition, the example Sarah gave is very comprehensive, and I appreciate that very good example. One of the groups within CDC, our news media branch, is taking, they analyzed 20 press releases that they've had over 2016, and they took baseline scores for each one of those press releases and identified 2 areas where they want to improve. So over this next year, 2017, they will then take another random sampling of press releases and score them to see if after training and through constant updating of staff skills, whether that increases for those areas they've selected. So you could even use the index as score as a way of evaluating progress.
Great. Quick follow-up question to Sarah's answer. What is a good bounce rate? What would you consider a good one?
You know, that really depends on the resource. I think if we're looking at a page like what is lupus, a 50% bounce rate is not too bad. We'd like to see better, but that seems to be about average. What's really happening in terms of trends is that people don't really surf the web anymore. You know, that it's much more what we call short, shallow, and specific. People tend to be primarily on mobile. We know that about 70 to 75% of the people who visit our website are doing it on mobile devices. And they tend to have one question about lupus, and then they find their answer, and then they leave. So that, that really, organically, we already have a situation that's leading to a higher bounce rate. So I would say, depending on the resource, but about 50% I would be fine with.
Great. Next question is whether anyone can use and download the widget, or is that only available to health organizations? Lourdes,
I was going to let you answer that one.
Oh, I'm sorry. I was on mute, and I was just talking away. It is on our public website, and anyone can download it.
Great. And then have you used the CCI to review letters to parents or guardians around school-based immunization, i.e. type of vaccine, number of doses, when vaccine is offered within the school year, how to complete the consent form, et cetera? So have you used this in letters to parents and guardians?
I don't know that it's been used specifically for letters, but I know that we have many fact sheets and communications on vaccines and the concerns that parents have. Our National Center on Immunization and Respiratory Disorders has used the index quite a bit in training their staff to develop materials for that population, so that may be worthwhile exploring some of their products.
Great. And then how can the tool be applied to visual images within context? How many items within the tool are related to visuals, or do most items pertain to text content?
That's a great question. And in Part A of the index, specifically Part A, item number 3, which talks about how the main message is emphasized with visual cues. What we're talking about there is a visual that can span anything from an infographic to a chart or a table, because you might be talking, your audience might be, for example, doctors or epidemiologists, et cetera, who would prefer, let's say, a trend graph. Or it could even be a stock image about a doctor giving a shot to a child. So anything that supports the main message is appropriate in our recommendation. And I also, one of the last slides that I presented on heart disease and expressing the risk that people have, so using the person sitting down to demonstrate inactivity as a risk factor. Think about what your main message is and what those visuals that would most advance the main message would be. And we have found that some really productive conversations have come from working with our graphic designers, because they are such creative ideas, and together with our subject matter expertise, it really has lent itself well to presenting that in materials.
Perfect. Next one is, our struggle is often finding a clear, concise message for a campaign versus messages for a fact sheet or brochure. How do we use the tool in this case?
I think you take the campaign almost like the one product, right? So you talk about who is that audience for the campaign, and what is it that you want them to do with that information that you would be disseminating with the campaign, and what your one main message is. Now, in some cases, as Sarah was mentioning, in health we have various audiences, but if you can select and focus on one primary audience and what their needs are, I think you could use even that cover page to help craft and focus your messaging.
Wonderful. So we've gotten to the end of this current batch of questions. I'm going to move on to a couple of polling questions for the audience. But if there are any further questions, I will do a scan before we wrap up, so feel free to post those as you think of them. One of our last polling questions, we're wondering whether you think this method or tool could be useful in your practice. Whether you think it would be very useful, somewhat useful, not at all, or if you're not yet sure. So we're going to wait a couple of seconds while those answers come in. It looks overwhelmingly that the audience feels this will be very useful in their practice, which is very encouraging. It seems that this has been this is a tool that would be very applicable to almost all areas. Anybody who's tailoring messages to any type of audience, so that's wonderful to see. Your feedback is very important to us. We've posted a link in our chat section about a survey. It's very, very brief. It shouldn't take you more than a couple of minutes to do. That link will come up in a couple of seconds from Rowan. Your comments and suggestions do help improve the resources that we focus on and planning future webinars. So if you can take the time and fill that out for us, we would certainly appreciate that. The survey link is now in the chat section. And then we do have one final polling question, which is, what are your next steps as you're leaving the webinar? Do you think you might access the method or tool that we have referenced in the presentation? This one you can actually select all the answers that apply. So you can either access the method or tool, read our NCCMT summary about the method or tool. So that's our summary in the registry of methods and tools. consider using it in practice or telling a colleague about it who you think it might be helpful for. So looking at the responses that are coming in, it looks like most people are going to use it, access it, and tell a friend about it. So it looks like this is going to help increase use of this tool quite a bit, so we really do appreciate that. And now our next webinar in the series will be held on Tuesday, March 21st, same time as today. And we will actually be focusing on the MetaCat, and that is a tool that you can use to appraise all types of public health evidence. So it's a single tool that can appraise many, many different types of evidence and study designs. It will be presented by the developer of the tool, and we also have a user story lined up for that one as well, so somebody that has used that tool in practice. So it'll be another, hopefully, really good presentation on what I think is a very, very useful tool for anybody working in public health. Now, just looking at the chat window, I don't see any more questions. So I do want to say thank you so much to anybody who, we got one. Okay, so I have one more question. This was sent privately to the host, so I will read this out loud. If we apply the Clear Communication Index to our English content, does it translate well? Have you tested the application of it when translating patient education into other languages?
We haven't had the opportunity to do that. We did translate the index to Spanish, and we were in the process of applying it to the messaging that was coming out of Puerto Rico's health department. But at this point, we don't have any data to share from that, and certainly haven't translated it yet for other languages. But if you do, we'd be very interested in hearing your findings.
Okay, great. And then we have one here for online resources. The images and fonts, etc., that we use become complicated due to AOTA compliance, at least how we have interpreted the legislation here. Does anyone else see this as an issue? And then I'll fill in, because I know you are both U.S.-based. I think the AOTA is the Accessibility for Ontarians with Disability Act. May have gotten the words wrong there, but basically what that means is that any website for the public, and again, I'm going to ask the question asker to correct me if I'm wrong, but websites do need to offer larger font for people who do have visual issues and that type of thing. So do you see that as an issue at all when it comes to designing your websites?
Not in our case. In the U.S. Equivalent of that is Section 508 compliance. So this very much is in line with that. Our templates for web are based in a way that all people with disability are able to access our materials. So the index really focuses more on the text and developing that text. The images that we put on, whether it be an infographic or any other type of table, would then comply with the letter of the law for people with disability.
Perfect. All righty. Well, this was, I think, a fantastic discussion. Again, we do really appreciate your time for the presenters. It's been a really, really great overview, and I do think that this has been a really great tool to feature, as it does seem to apply to so many different people working in public health. I will pass it back to you in case you have any more comments for the audience, but I just wanted to thank everyone who joined and participated. It did make for a really great discussion, and we do hope to see you next month. So back to you, Lourdes and Sarah.
Thank you so much for the opportunity. We're always appreciative of a chance to talk about the Clear Communication Index, and we're so thankful.
And I'd just like to echo that as well. Thank you so much for letting us visit with you.